Do you have any wise words of wisdom for any other occupational physicians that may be thinking about getting into medico-legal work but are on the fence?
Like I said, if you enjoy spending time with someone and delving deeply into cases, it's great work.
Welcome to The Consult by Australian Specialist Hub, where we discuss medicine meeting the law. I have occupational physician and dual qualified GP, Dr Trish Batchelor, here with me today. Thank you for joining us, Trish.
Thanks, Hanna. Thanks for having me.
Now, you've got a very, very interesting history of how you got into occupation. Well, I think it's very, very interesting. Do you want to tell us a little bit about how you got into occupational medicine?
Yes, it's a long and winding story. So I was sort of thinking, why did I even do medicine in the first place? And actually, I was thinking to do sports medicine. I was quite a good, believe it or not, athlete when I was younger. But when I went to university, the two things I was really interested in were infectious diseases and immunology. But I also realised that being in a hospital and living one place for the rest of my life was not for me. Mm-hmm. So decided to do general practice training. And then during university and after university, travelled a lot and became passionate about spending time in the Himalayas and trekking and so forth. And so general practice was perfect for that because it gave me the freedom to come and go. I had the great fortune of working in India, then in Nepal, where I met my husband, and then got involved in travel medicine. So how does that all lead to this? One of my jobs when I was in Canberra was in charge of a travel medicine clinic where clients like Foreign Affairs, Federal Police and so forth, so preparing their members for deployment and dealing with their senior medical staff. So on the back of that, if you like, I became the consultant medical advisor to the Australian Federal Police. At which point I realised there was this whole swag of occupational medicine that I really didn't know anything about, wasn't trained to do in the general practice setting. So I decided to commence the Monash course down here in Melbourne and met a whole bunch of people who were doing OcPhys training. So that's how I got into it. And it turned out to be, I really enjoyed it because of the breadth, like it's a completely different way of thinking about medicine. Normally in general practice, it's just you and me as the patient and the doctor, if you like, whereas occupational medicine, very broad. You're thinking about, the triad of the worker, the workplace and the work, and often very involved with organisational elements, policy, big picture thinking. So that really appealed to me.
And big impact. I think occupational medicine has a huge impact on the long-term health of workers.
Oh, absolutely. Yeah. Absolutely. Yeah.
What does a typical month look like for you working with Australian Specialist Hub?
So at the moment, I'm doing a mix of telehealth from Canberra, some face-to-face in Canberra is coming through. I might travel. I've been asked to go to Brisbane, to Hobart, and now Melbourne. So starting up down here in Victoria as well.
Oh, yep. Fantastic. And what type of cases are you seeing coming through?
A mix again. So I do some TPD work, workers' compensation work, fitness for duties. Yeah, so really all of those that would be standard for an occupational physician. Permanent impairment, of course. So I have permanent impairment qualifications in 4 and 5, and in Victoria, spine, upper limb, lower limb, skin, occupational infectious disease, also ComCare and AMA5 for all the musculoskeletal conditions.
And we were just talking about assessing long COVID claims, particularly in Victoria, with the specialised modules through WorkSafe. Do you want to tell me a little bit about that?
Yeah, so look, I might be wrong, but as far as I'm aware, based on the training that I've done so far in the ComCare system, New South Wales and Victoria and Tasmania, actually, Victoria is the only state that has a standalone occupational infectious disease module for permanent impairment. So having that background of tropical and travel medicine and having worked overseas and worked with people deploying overseas as well as, infections here, that really appealed to me. So a lot of the cases are long COVID because, of course, that is an obvious occupational disease. I mainly see nurses and teachers. I've got to say, the majority of the cases there. But it could be many other infectious diseases that people would be exposed to. Q fever, for example, leptospirosis in farmers, dairy farmers. It could be tuberculosis even. Yeah, there's a wide variety. I do not take a cookie cutter approach and, like to spend time with people, and it's very important to everyone, when their case is done.
Out of curiosity, with your travel medicine and the extensive diving in beautiful places that you do, do you do dive medicine?
I don't.
Oh.
I just went to a dive medicine conference, but no, look, I don't, because there's sort of a limit to how much you can do, I suppose.
Yeah, only so many hours in the day.
That's right, yeah. So I prefer to enjoy diving for fun and leisure. Yeah.
Get me to my next question. What does an occupational physician do to unwind?
When I'm not diving, I guess walking, just reading, spending time with the family. And then my holidays now are, I got back into diving, I did a little bit when I was young, but my son, who's 21, he and I got qualified 3 years ago, so we enjoy going diving together, and that is a fantastic way of switching off, because it's like meditation underwater.
No phone can go off.
No phone can go off, and you're focusing on your breath, controlling your buoyancy, and looking at beautiful, beautiful nature. So it's an amazing experience.
Where's your favourite place to dive?
Well, I just got back from Palau, and that was pretty awesome.
Yeah, stunning.
So far, yeah.
If you weren't doing medicine, what would you be doing?
Oh my God, I have. You know what? When I was young, I wanted to be a documentary filmmaker.
Oh wow!
And travel, and in fact, when I went to university, I started an arts degree with a view to becoming a diplomat and joining foreign affairs. And my politics lecturer at the time actually said, is there anything else you want to do? It's a really hard job to get into for women. And that's when I switched to medicine. So hilariously, I ended up being the principal medical advisor to foreign affairs for 4 years. So I got got it in the end. Got there in the end.
You showed him.
Got there in the end.
That's fantastic.
Yeah. But I guess that was just my interest in travel and nature and that sort of thing. Yeah.
I'm glad that you weren't disheartened by his comments.
No. And I look back now and I think that's a very strange thing to say, because, when I was at Foreign Affairs, the secretary was a woman and many of the senior leadership were women who were of a similar age to me. So anyway, it all worked out well in the end.
It did.
So,
it did.
Yeah. I mean, I love medicine, so it's worked out great.
Yeah. We spoke about that earlier, that one thing that we get asked a lot from the specialists is what happened to that case in the end, because you see a snapshot of it. We see that person for an hour, you've reviewed their file, and then sometimes you don't know what the end result is. Yeah.
So what was the question there? Because I guess, like something I've just written in a report there is the difference between, there's a transferable skills report, which is an on-paper kind of theoretical skill review versus an actual clinical assessment of where that person is in a holistic way at the moment.
Yeah.
Is that what you're getting at?
Yeah,
the difference between
absolutely.
that versus an OP
Because can that person
review.
go back to being, can they be an Uber driver and they've never been an Uber driver in their life? Or you're seeing some of those types of reports coming through.
Yeah. So there's a difference between that sort of point in time desktop, these skills would be transferable, but
in real life,
it's not taking into account a holistic view of that person's capacity, their mental health at the moment, or, have they actually got the capacity to retrain or not? Have they got the capacity to do that? Is there any likelihood at all that they're going to get a job in the real world? It's a completely different matter if you're being supported by work cover to maybe work a few hours a week versus having to go out and find a job when you've got, significant functional limitations.
Yeah, absolutely. And you're competing with able-bodied people who have no injuries in that market.
Yeah, and there's still stigma, I think,
Absolutely.
Yeah. So that's difficult for people. And if they're not, there are people who are not, who have limited skills, they don't represent themselves very well, etc. And that makes it even harder. Yeah.
Adds that extra layer of complexity.
Yeah. Yeah. And the the question, I think, of doing general practice before occupational medicine, I think I almost feel like everyone should do it. A bit of maturity, life experience having that very broad medical background feeds in very well to thinking about people in a more holistic way, you know, and not just focusing on their injury, but, you know, everything about them.
Injury prevention and health programs, all those sorts of things. I think people don't even think of those extra things where occupational physicians add a huge amounts of value.
Yeah, I mean, if you look at our curriculum, it's very broad, you know, so a lot of what we do in the medico-legal space is quite narrow, but, you know, for example, environmental medicine, you know, when I was at DFAT, I wrote a policy on managing air pollution in posted employees. Like it was a document that was then used by all the federal departments who had people posted overseas. Ultimately, you know, this was very shocking to me. You know, when I went to DFAT, I'm like, okay, I've got this. You know, I've done my infectious diseases, general practice. I can answer those calls in the middle of the night about my 2-year-old sick in Nigeria, whatever it might be. I've got the occupational medicine, and the thing that landed on my desk that people were worried about was air pollution. I'm like, okay, hadn't thought that might be a problem. But I was able to utilise what I'd learnt in the environmental medicine space to write a full management policy that went all the way, you know, all hazard management and education, town halls, all of that sort of thing. And in the end, the Australian government, I'll say, stepped up and implemented controls in the embassy and in the housing to the point that the air quality in the embassy in Delhi and in the housing was better than in Canberra. So
that's impressive.
It was fascinating because people were so frightened and scared, and it was addressing that fear, giving them facts, but also addressing the issue and doing what you could about it, and it made a massive difference.
Yeah. Enormous.
So that's a whole other element of what we do. It's occupational and environmental medicine physician. So, you know, dealing with all sorts of different things that people don't realise.
Is every occupational physician also an environmental physician? Because you see that title drop off every now and then.
You do, and I think it's difficult. It's certainly anyone who's been through the training program, probably it's probably changed at some point, but in the last 10, 15 years, that's, you know, we should be OEP, occupational and environmental medicine physician. Yeah. So, you know, dealing with exposures to metals, to all sorts of things. Yeah.
Mm-hmm. So as a tradition, we've asked all of our guests a series of quickfire questions. Okay. So what's the most remote or unusual place you've had to assess someone's health?
I would say, so when I worked in Nepal, I got involved with a small NGO that looked after porters in the trekking, and in that, I set up a small clinic in a place called Machermo, which is in 4,500 metres altitude on a trekking route in Nepal. And so we had a room in a lodge with medical equipment, and we're treating high altitude sickness and so forth. So I'd say that's probably got to get the answer on that one.
That's pretty cool.
Yeah.
Not many people can say they've done that.
No, a few people have worked at Machermo, but not too many.
Outside of medicine, we hear you are a vivid diver. How do you unwind, and where has diving taken you? Oh, I feel like we covered that one, but I feel like there's probably a second.
Yeah. So yeah, as you said, I love diving. Where have I been recently? I've only been diving for 3 years, but I've hit my 130th dive just recently. Palau was amazing. Indonesia's fantastic. There's so many different places you can go. Raja Ampat's famous. Been there a couple of times. Vanuatu, also Queensland. So. Love diving. Walking, I used to spend a lot of time walking in the Himalayas. That kind of stopped with kids, but have a dream to go back and do some of the walks there, and a massive dream to go to Bhutan. That's my dream place that I'd like to go.
Working with veterans, occupational medicine, tropical medicine, how do you stay across all of it?
Oh, well, you speak to my family. Work too hard. Well, I'm a bit of an inveterate learner, so I spend a lot of, attend conferences, I read journals, I just read a lot, and working in the field, I guess. So, for example, with the tropical medicine, I've been teaching on a travel medicine course at the University of Otago for about 20 years, so that makes sure that I keep up to date. Veterans is a passion of mine that I spend a lot of time working. I still work at Defence a couple of days a week, which is kind of the most occupational physician job around, if you think about it. And, occupational medicine, well, that's
One thing about occupational medicine that surprises people when they find out what you do?
I think most people don't know what it is, so I often start my consultations by saying I'm an occupational physician. Most people don't know what that is. We work with work-related injuries and illnesses, and they go, oh, okay. Yeah, so people are often quite interested because they've never heard of it. And there's not a lot of occupational physicians around, so that's fair enough. Yeah.
It feels like it's growing. I feel like the need for occupational physicians is also growing.
Oh, there's definitely a need, in terms of the numbers coming through. The problem is it's a reasonably elderly group. So, as new graduates come through, there are people retiring at the back end. So I'm not sure that it's growing as quickly as we would like. Yeah.
It's definitely one where we do educate quite a lot of people who call up and say, oh, we're trying to assess this particular case. So maybe TPD and fitness for duties is one that comes across a lot. They're reaching straight for the orthopaedic surgeons or the neurosurgeons or the neurologists and things like that, where we go, okay, well, we're looking at function here. Have you considered an occupational physician? And you're sort of teaching them this is what occupational physicians do.
That's right. And as we sort of alluded to earlier, I think that more holistic view, and in occupational medicine, the other thing is we think about causation. We think about the link to occupation. We think about how can we modify work to help people stay in the workplace if that's appropriate. What might put them at risk if they stay at work? How do we manage those risks, not just themselves but others? The concept of inherent requirements, which actually is a safety issue. For example, if you're in the police or the military, there's certain things you have to be able to do safely. And if you can't, then, you have to look at doing something differently or doing another job, because you can't be putting yourself or others at risk. And the work I do in the military setting, I'm a senior doctor there, so a lot of that's teaching and what have you, but my patient cohort is very much the medically separating members, who are often very complex with mental health as well as multiple physical conditions. And I think I've learned a lot with my work with veterans about mental health as well, and how that impacts on physical health, and that, the mind-body connection, how important that is. So, and I would not want to say that other specialties don't do it the same, but I think in occupational medicine we are taught to think in a more holistic way.
We're often asked, to what extent can occupational physicians comment on mental health? So you might have somebody come through with a long list of physical injuries, and then they sort of got anxiety and depression at the end, and clients go, okay, well, do we send that to an occupational physician? We can get sort of an overall report, or do we need to then separate that off to the psychiatrist and get a second report on that?
I think it depends on the complexity. For me, it's the complexity of the psychiatric condition. You'll probably see in most of my reports, I will at least do a screening, and a lot of occupational physicians do. They might do a K10 or a PHQ-9 or something. I don't think it's necessarily appropriate that we are making diagnostic assessments when we're not psychiatrists, but we can certainly be commenting and saying, based on the screening tests and how they presented, depression appears to be a factor in their recovery or whatever, So, and then if it's more complex, you could have a panel, right? So you might have an occupational physician and a psychiatrist speaking about the same person and talking to each other and giving a kind of dual report if it's very complex. Do you have any wise words of wisdom for any other occupational physicians that may be thinking about getting into medico-legal work but are on the fence? Well, I think like I said, if you enjoy spending time with someone and delving deeply into cases, it's great work. So that's probably, I'd say do it if you're interested in doing that. Mm-hmm.
What's your favourite thing about working with the Australian Specialist Hub?
Ooh. I think the staff are lovely. They're great,
They're great
very
team.
friendly, really nice team, responsive. Yeah, so really happy. And it feels very personal. I think, I don't feel like I'm working with a big corporate. It's personal, yeah.
How do you ensure examinees feel genuinely heard throughout the process, and why does it matter to the outcome?
That's really important, because I think, as a doctor doing medico-legal work, you see a lot of people. It's kind of your bread and butter. But for the person sitting in front of you, it's a really often they're really stressed. They may have done some before, they may not, they don't know what to expect. It's a really important meeting for them. So it's so important to help them feel comfortable. So part of that is you have to be professional, but you have to be friendly. Try and put them at ease. Most importantly is just listening. I would almost never have an assessment that they're less than an hour. Usually it's an hour to an hour and a half. Most people, there's the occasional person you need to get back on track, but most people can give you a very good and detailed story, directed story during that time. And it's rare to get that amount of time with someone, and people feel heard. At the end of it, you give them the opportunity. Is there anything else you'd like to tell me? Is there anything else that you think is important here? And I think that's just very, very important to make people feel comfortable in what is quite a stressful scenario for them.
Absolutely. It's so important. And, it's day in, day out for you and I, but that might be that person's first ever medico-legal assessment. Right. They're in the middle of litigation. They've got a high amount of stress. We see people at their worst. So I think putting them at ease is really important. They feel like they've had a thorough and fair assessment.
Absolutely. That's right. And if you've spent that time to listen, people are generally very forthcoming. If you don't talk over them, you let them talk, people will tell their story.
Well, thank you so much, Dr. Trish Batchelor, for joining us on the Consult by Australian Specialist Hub. It's been a pleasure having you here.
Thank you, Hannah. It's been a pleasure. Thank you.